supply, and the parasympathetic nerve supply is responsible for contraction of the detrusor muscle, and it comes via pelvic splanchnic nerves, and the root value of these pelvic splanchnic nerves is S2, 3 and 4. Like there is a craniosacral outflow of parasympathetic nervous system. So through sacral, second, third and fourth, the parasympathetic nerve supply comes, and whenever there is, it also carries the pain of the urinary bladder also reaches also goes via parasympathetic nervous system. And whereas the sympathetic nervous system is vasomotor and inhibitory to the detrusor muscle, and it comes via superior and inferior hypogastric plexuses. The root value of these sympathetic nerve system is T11, T12, first lumbar and second lumbar spinal segment, and both the parasympathetic and the sympathetic system, they carry the pain impulses. Now the third component is the somatic nervous system. The somatic nervous system is responsible for our voluntary control of micturition. It mainly acts via controlling the external sphincter, and the nerve that is involved is the pudendal nerve, precisely its perineal branch. The root value is same like that of parasympathetic, S2, S3 and S4 nerves. So first there will be feeling. The bladder fills with urination. So with urine it fills about 200 ml. So during the filling phase, the afferent impulses travel via parasympathetic. So due to that, the sympathetic firing from L1 and L2 happens, and it releases the noradrenaline. The noradrenaline has got two receptors, alpha 1 and beta 2. The alpha 1 receptor is located, alpha 1 receptors excites the internal sphincter, whereas the beta 2 receptors inhibit the detrusor contraction. So once the detrusor is contracted, the bladder expands, and excitation of the internal sphincter, the sphincter is contracted. So in the meanwhile, in the filling phase, there will be pudendal nerve. The pudendal nerve is contracting the external sphincter, and there is a cortical center, which is the higher center which controls the micturition, and it excites the pontine center. So this happens whenever we are in the appropriate surrounding where the micturition can take place. The pontine center inhibits the sympathetic firing which was occurring from L1 and L2 segment, and it also excites the parasympathetic supply which is coming from S1, S2, 3, 4 segment, and due to inhibition of the sympathetic and excitation of the parasympathetic, there will be the internal sphincter will be relaxed, the inhibition of the detrusor muscle will be lost. So due to these four factors, the urination occurs.